A pleasant day and a warm welcome, ladies and gentlemen, to your medical discussion iMed. We talk about numerous conditions, diseases and some sort of features that you will encounter in your day-to-day life, because each and every person concerns about well-being. It's about physical, mental, social and some sort of a spiritual well-being as well. So we involve in certain discussions that will be fruitful in order to gain some sort of a benefit, some sort of a knowledge to lead a successful and healthy life. So in the previous episode we were discussing about leprosy, and even when talking about children, it is one of the most concernable factors, as when it comes to the aspect of children we consider a lot, because rather than an adult, we consider about children as they have survived in the earth for a shorter period and they have a long way to go. So today we'll be focusing about the childhood aspect of leprosy. So to do the honors, we invited Dr. Indira Kahavita, consultant dermatologist of the anti-leprosy campaign. Thank you very much, madam, for accepting our invitation and joining us with today's discussion. So madam, we talked about leprosy, and even it was a less discussed topic in the recent days because we thought that the disease is totally eliminated. So what is the condition in Sri Lanka?
Yes, actually when we talk about leprosy and elimination, Sri Lanka has it's like this. Now we talked about the WHO's involvement in leprosy. WHO earlier in the 1990s had given some targets for elimination of leprosy to the world. That was elimination of leprosy as a public health problem. That means every country was supposed to bring down the incidence of leprosy to a certain level where it could be manageable. Like, you don't need a special campaign to manage leprosy. It can be managed in the public health and the general health services to bring it down to that level. That level was to have a prevalence or having a caseload of leprosy of less than 1 per 10,000 of the population. So for Sri Lanka, we could achieve that target, having less than 1 case per 10,000 population in 1995. This was a target given to the world for the year 2000. So we achieved it 5 years earlier.
Right.
But it means 1 case per 10,000 population. So you can still have a fair number of patients.
Right.
But when we talk about elimination, especially if you use the Sinhala terms used for elimination, there was some confusion, because when you say eliminate something, you say you don't expect it to be there. You expect it to go away.
Completely go away.
Yes, completely go away. So there was this technical term could not be understood by I think all the lay persons, and even by certain percentage of healthcare workers as well. So the importance, the emphasis given to leprosy was reduced, and people started thinking, okay, we don't have leprosy now, but we do, right? Now we have, every year we have about 1,500 to 2,000 new cases. You will be learning a lot about the prevalence of leprosy in this country later from my colleagues. So leprosy is a problem, and it is a problem for children as well. So that is why we need to talk about this. So if we look at like how badly children are affected, you can see this slide, you can see here the percentage of child cases out of all the patients that we diagnose. So if we if you look at the year 2003, 4, 5, in those years we were diagnosing about 2,000 new cases, and out of that about 11%, 10% were children. So that means about 200 children, right? And you can see that our child case percentage is now at 10.7. You cannot see it in this picture. It's cut off at 2017.
Right.
But for the last year 2021, our child rate, that is the percentage of children out of all those diagnosed was 10.7.
Yes, madam, there's a small fluctuation in the middle of the graph. So that means like there was a certain disturbance, like we got a lower level. That means it's fairly good.
No,
so
I think that was just that we just missed diagnosing at that point, 2012, because it is coming up to 9.7, 9.2 again. Right? So it was just that we may not have done enough active case finding in children at that year.
Right, okay.
Right?
So, that means in this graph we have
roughly about 10% are children.
Yes, means they have maintained a considerable blood flow in Sri Lanka.
And for this year, our child rate is around 14%. That is not because children all of a sudden started getting leprosy. No, that is not the case. This last 2 years, 2020, 2021, with the COVID-19 pandemic, our emphasis on health was only on COVID, nothing else. So diseases like leprosy, where public health services are needed, they were neglected, and people didn't come for treatment for any other condition. So what we are seeing this year is probably the backlog from those 2 years. So even if we diagnose 250 children this year, I don't think this is something for concern. We are just finding those children who were having the disease, living in the community and not being diagnosed.
Not being diagnosed. That means they all together they are diagnosed in a particular set of areas.
Yes.
The huge number comes out.
So in 2022, 2023, maybe even in 2024, we may diagnose more children.
Which were to be diagnosed in a previous year.
They were having the disease, they were not diagnosed, right? And the most important thing about children having leprosy is now last time we discussed about leprosy having a long incubation period. So if in a country the vast majority, let's say 99% are adults, in that case we can always argue, okay, these are people who acquired the disease a long time ago and now manifesting the disease. Now only they are coming up with symptoms. But when we see it in children, they have lived on earth for a short period. So that means they got the disease recently. Right? So the disease came into them recently. That means there is ongoing transmission. We are transmitting the disease within our community. So that's the most important thing about children. If you have a fairly high child rate in a country, that means there is ongoing transmission. You still haven't been able to stop the disease from transmitting within the community.
So is that the importance of diagnosing through children, madam?
Yeah, and also like now we saw that Sri Lanka's child rate is 10%. Globally the child rate is about 7%. So in the world only about 7% are children. These are children below 15 years of age. So in our country we have a higher child rate. That means still there is considerable transmission going on. We haven't been able to stop this. So that's the importance of the child rate. And if you look at where are the areas where children are where are the areas with more child cases, you can see there are a few districts which are colored in red, the entire western province, and then the Putlam district, and you get Jaffna and Vaunia districts, and Batticaloa and Ampara districts. Right? So you see that these areas, the percentage of children is more than 10% of the cases for that district. Right? So those are the areas where we need to concentrate more and look for cases. If you look at the Colombo district, again I am showing you this for you to see that it's not uniform. Now if you look at that chart there, this is for the first 15 years of this century. Moratuwa had like almost 250 cases. Right? So Moratuwa is actually a hot spot. Right? So that is the Moratuwa Divisional Secretariat area. Right? And then you can see the Colombo, Greater Colombo, and like the CMC area. That if you take those two together, that is about 320 children. right? But you see Avisavela region, Sitavaka Division Secretariat, that is green. Only 2 children for those entire
area.
15 years. Right, so you can see what a difference that can be there within one district itself.
That means there's a huge diversity, and the figures they fluctuate, vary depending
so
on the
you
condition.
can't just say the entire Colombo district has a high child rate, but if you look at the areas along the coastal belt, definitely you have to remember that those are hotspots for childhood leprosy.
Right. Okay. So, madam, when it comes to children, is it the same procedure that we are going to diagnose as adults?
Clinical features may be less. Right now, you can see a patch here, a light colored patch.
Right.
In the vast majority of children, you see very tiny patches like these. Most instances, they are like slightly visible. And the child and the parents may just ignore this. Right? And another problem that we encounter with children, you can see some more patches like this here. Now this is a little bigger patch, and the child is also older. Like now we know that leprosy, the hallmark is loss of sensations. So one problem we encounter in children is, especially very little children, say a 3-4-year-old child, it's very difficult to check for sensation. Right.
So that means, madam, at this particular place also they might be having some sort of a sensation.
Yes, there is sensory loss. Sensory loss is there, but showing it is the problem, because they are children. They may not be able to point out whether they can feel it or not. But there are certain telltale signs that we use. One is like the children themselves feel that it feels different. So they may be sort of picking on it. Right, just pricking it with any sharp object. Sometimes, I mean, there were instances where children were sort of showing their friends how brave they are by asking them to prick this. Right, because they cannot feel it. Right, so we have to be very observant when it comes to children. So, and also there can be certain other confusing things, like other differential diagnosis, like especially in young children with dry skin, they have these white patches on the cheeks, right, which is part of the dry skin spectrum, but that leprosy can be mistaken for that, or this condition could be mistaken for leprosy.
Yes, vice versa, both sides affected.
And also aluhang, and sometimes birthmarks. Right. So if a child has had a patch like this since birth, it cannot be leprosy. But recent onset patches, which are like not changing much and not itchy, right? Not itchy, not painful, it's just there and it's not spreading like aluhang, then you have to suspect whether this could be leprosy. Right? Again, you can see this lesion here on the fingers, and if you look at the area, like you can see there's a red rim and light colored patch, and also you can see that the fingers that are associated with that patch are darker, and even the finger pulp, the shape of the finger is different. Now you can see the fifth finger, which is nicely the contour, the shape is there, but even the fourth finger, there is some flattening. So the numbness has been there for a long time, and there is tissue loss in the fingers. Right? So this has been, now this is again a child, I think a teenager, right? Or it could be very subtle like this. Can you see this very slight aluhang like thing?
Yes, appearance.
Right? So this is not aluhang, but this is leprosy. Right? We talked about this lesion in the back of the elbow earlier also. So it could be there, and especially in a lesion like this, the child feels that it feels differently, and chances are that the child may have sort of tampered with it, and there may be certain lesions like ulceration and things like that within the lesion because the child had tampered. Right? Or like something like this, where the child may complain of difficulty in writing, especially the handwriting may sort of become worse than what it was, because the sensation is less, and there may even be a little bit of pain there. So the child finds it difficult to write with that hand, right? So actually this child came because of this. He couldn't copy his notes, right? So the other thing that can look like that, this lesion is eczema, where there will be itching and scaling rather than a pain and a numbness. Right? So even in this patch, like this was a slightly older child, and we were able to show that there was loss of sensation.
So otherwise, like this condition, if coming from a smaller child, it's very difficult to identify.
Yes, very difficult. And then very rarely you can have lesions like this, which is again quite like Aluham. Right? You can see multiple patches, a lot of patches, light colored patches. There's a slight reddish tinge there, but most of the times to the casual observer this is Aluham. Right? Very rarely you can have this sort of raised lesions, and you can see the earlobe thickening there. Right? So by the time a child develops something like this, the child can infect others. Other than that, all the other pictures that we saw earlier, they are non-infectious.
That means,
in that case, what I mean is that those children, simply because they have just 1 or 2 lesions on their skin, they are not able to pass the disease to anybody else. Because they are not having the mucosal involvement, they are not having lesions on their faces. So children like that are like not a problem to anybody else.
That means we can talk a little on this at this moment, madam. Like people tend to neglect and set aside and even like move to a separate part of the thing that they are in a conversation or something. Alright, so you don't come to us, you have this condition. So this is not a reason to set aside those people.
Definitely not, because as I told you, majority of children with leprosy do have just one patch. That one patch stage is not infectious to others. It's only that the child is having the infection within him, but the immune system can contain the disease to that particular area. So that child's respiratory mucosa is normal. So the child is not putting out any bacteria to infect others. And also, if we know that this is a child with leprosy, that means the child has been diagnosed and the child is on treatment. So the most important thing is, like whether it is a child or an adult, a person who is on treatment for leprosy is not infectious. Because their bacteria are now getting killed with the very strong antibiotics that we are giving. Therefore, anyone who knows that he or she is having leprosy and is taking their treatment regularly is not a threat to the society. It's the person who doesn't know that he or she is having leprosy, and because of that just spreading the disease. It is that person who can be a problem. Other than that, whether it's a child or an adult, if you know that this person is having leprosy and taking treatment properly, that person can have a normal life.
No harm from that person.
No harm at all. I mean, they can continue to go to school, adults can continue to go to work. I mean, we don't even give special leave to patients who are diagnosed with leprosy. So in case of children, if we diagnose and start them, like let's say we start somebody tomorrow, the child can go to work the next day, then go to school the next day.
As a normal child.
Yes, definitely.
So then, ma'am, you talk about the respiratory infections and moving out of like droplets like thing from the bacteria will transmit. So if I'm touching a person with leprosy, the particular area, and I'm touching my body or touching my nose, face, like COVID thing, will it infect me?
No, it doesn't. It doesn't, because the pathology, the disease is deep in the skin. Not on the surface. The surface is completely normal. You cannot transmit the disease from touch, like through intact skin. You cannot transmit. Now, I have been treating patients with leprosy for the past 20 years. and I make it a point to touch all my patients
Mm-hmm.
because it's very important that the doctor touches the patient. Because now you know, if you go to the history of leprosy, leprosy, the person with leprosy has been considered an untouchable.
Right.
Right. So when we talk to somebody, when we tell them that this is leprosy, they feel sort of very isolated. This is a dreaded disease. So when the doctor touches the patient, that shows you that okay, I'm not an untouchable, I'm a normal person.
Even doctor touched me.
Yes.
Yes.
And I know that I cannot get it from touching that person. Right? Therefore, please remember, it is not spread by touch. So it's especially so in the case of a child, because you know, young children, they just hug each other, they are just, you know, touching, they are just close to each other. There is no risk to the other children if we have a child with leprosy who is taking treatment.
Right. So ma'am, how those small children get infected, from the school environment or the place where do they live? So can you just comment on that?
Yeah, for leprosy to spread, you need to have a prolonged respiratory contact. That means you have to live in the same confines, same household or same building for a long period. This is usually, it is said that you need a contact of about 20 hours per week for about 3 months. So our experience is, in most instances, it is the household. Right now, if you take the general leprosy patient population, what we have found out is about 1 in 5 of our patients has another person affected with leprosy at home.
Right.
That is not because it is hereditary, but because it is spread from respiratory source. Therefore, like if one gets a disease, the same way another person can get the disease. Right? So for the general population, it's about 1 in 5, but from the data that we have so far, for children, this rate is about 1 in 3.
Right.
So about 1 in 3 children have another person affected with leprosy at home. So it's most of the times it's not even a sibling, either a grandparent or a parent.
Right.
Right? So it's actually the adults who have the responsibility to ensure that children don't get the disease.
So when talking about that particular responsibility, madam, so the anti-leprosy campaign itself do some sort of a social service, like they conduct exhibitions. So then can you talk about it a little bit?
Yes, actually now anti-leprosy campaign is the organization that is in charge of control of leprosy in this country. So as the anti-leprosy campaign, now our main emphasis is on children with leprosy, because as we talked about this earlier, childhood leprosy is an indicator of transmission of the disease within the country. So if we were to interrupt transmission, as WHO has as WHO's target for the future is, you can see here the phase 1 is interruption of transmission, where no new locally acquired cases among children for at least 5 years.
Right.
So our target now is to slowly, I don't think we can achieve it quickly, but at least slowly to achieve this target.
Right.
To do this, we are now emphasizing more on leprosy in children. So we are conducting several things. One is active case finding. We are going back to the our previous child cases, looking for their household contacts, and we do conduct now even in the school medical inspections, which are done routinely by the Ministry of Health. We now make it a point that all the public health personnel go and actively look for leprosy. In future we are going to introduce a few documents where the parents themselves can look for these skin lesions and point them out when the child is coming for the school medical inspection.
Right.
And also to increase awareness, like what we are doing today, we are doing several things. One is we are doing programs like this in mainstream media, and we have launched this social marketing campaign called Live Sri Lanka, which is actually short for Leprosy Initiative for Elimination. There we are doing most of our work in the social media, Facebook, Instagram, YouTube. So we have our presence in all these 3 channels, and we are disseminating information about the disease and what we are doing to control, and also to increase awareness among children. We conducted this art competition amongst children from 5 districts which have somewhat high child rates. That was the 3 districts in the Western Province, and Anuradhapura and Kurunegala. We had a overwhelming enthusiasm. Like we got more than 7,000 entries for this art competition, and like that was for children from grade 6 to 11, and the award ceremony was held recently. So like from that what we understood was children are very good at grasping the message. They had gone into a lot of trouble. They had researched, they had learnt about the history, they have learnt about how prevalent the disease is. Everything was there in their creation. So it's very rewarding.
Right. So that is the involvement of the anti-leprosy campaign in order to make people aware. So awareness matters. So we have to have a particular awareness, because like in order to eliminate, in order to reduce as much as possible the newly emerging cases, we won't be getting trouble in the future. So this anti-leprosy campaign is all about this, and you might be having a clear understanding about what leprosy, and today at this program we consider about the childhood aspect. So thank you very much, Madam Dr. Indira Kahavita, consultant dermatologist of the anti-leprosy campaign, for taking part in this program and giving a public awareness as well while discussing about the leprosy clinical conditions, manifestations in our previous program as well, and today with the childhood leprosy condition. So thank you very much, ladies and gentlemen, for watching iMed. So in the future also we'll be discussing more interesting programs. Thank you very much. Have a pleasant day. This is your favorite medical discussion, iMed.